Why does nurse procedure of pectus activatum fail so easily? Pectus activatum is a common chest wall deformity, and nurse procedure has long been considered the standard of treatment of this deformity. However, in clinic practice, we have found that many patients with pectus activatum do not get a satisfied result after receiving the nurse procedure. In other words, this surgery actually failed. Why did such a patient fail? This patient, a 14-year-old boy who was diagnosed with pectus activatum as a child, he underwent the nurse procedure at local hospital several years ago, and the post-operative depression did not disappear, but the new deformity appeared. It is clear that his nurse procedure failed. In order to perform the operation again, the patient went to many hospitals, but all of them didn't treat him due to the complexity of the deformity. The patient later came to our hospital and was performed another operation on him with satisfactory results. The deformity in this patient was very special, not a simple depressed deformity, but a compound deformity. His upper chest wall was protruding and depressed in the middle, and it was clear that his deformity was a new deformity completely different from the pectus activatum. It was quite certain that this deformity was caused by the failure of the nurse procedure. Imaging examination revealed the severity of his chest wall deformity. Since the sternum was in the middle of the protrusion and the chest wall was usually hard, it is very difficult to correct it. The method we used was special. We first perceived the bulges, removed the protrusion with Wilhelm procedure, then the depression with one procedure, and finally achieved satisfactory results. The circumstances of this patient's first nurse procedure are unknown. However, from the thoracic structures, it can be inferred that the stool bar was not placed properly in the first operation, and it was not placed at the bottom of depression. Such a position does not eliminate depression, but may cause the normal chest wall to protrude and form a new deformity. This should be the root cause of nurse procedure failure. The nurse procedure has always been considered a simple operation. However, the surgery itself is extremely demanding on technical details, and if the details are not taken seriously, it can easily lead to failure of the operation. This failure is very serious. In our clinic work, we often encounter cases of failure in various forms. In every case, there are painful lessons. The lesson of these cases is that it is especially important to pay more attention to simple surgeries. Otherwise, they will lead to failure easily. I'm Dr. Wang from China.